AskReddit. Doctors of Reddit, what is the most how the F did that happen to you case you've ever seen? Lady with very poorly controlled diabetes and morbidly obese came in via ED with a gaping hole on her thigh, like so deep you could put your whole fist through it. It was oozing ridiculous amount of blood, so much so she had to be transfused. Her blood levels were rock bottom. It transpires she'd accidentally cut herself when trying to wriggle into jeans. Meantime, the wound just kept getting bigger and bigger, and she attempted to just sort it by packing the wound with socks. Single worst thing I've seen. Working in the ER we had some interesting ones, but the simplest and most intriguing one I've had was a man came in complaining about chest and side pains. After a few tests to rule out heart issues, we discovered through an x-ray that the man had 19 fractures throughout his ribcage. When I asked him if he had been doing anything dangerous he replied with nope, just dancing. Needless to say I'd recommend not trying to do leaping flops into the worm on repeat on concrete, which is the only way I can fathom this occurring. And no, he didn't explain what kind of dancing. Old paramedic here. I had a 60s male found on his hands and knees quite dead. He was positioned to receive a dildo mounted to the door lifter on a garage door opener. The track was modified to run the length of a mattress powered by the 1-stroke 2 horsepower opener. He used the remote button to forward and reverse the lifter with a plate adapter for a large rubber dildo. He had taken a massive heart attack, at least he died doing what he loved. Saw a guy who had a pretty blunt machete lodged perfectly across the middle of his skull, but the angle was unusual and it was like perfectly along, so that caught my attention. Turned out the guy had, unsuccessfully, tried to murder his wife with the machete and later regretted it, so he hit himself in the head with it. He held it with his hand, sharp side front, and gave himself a whack perfectly in the middle of his skull. Thankfully the machete barely made it into the skull, and since it was along the middle it didn't touch any brain tissue. Work in a burn center. For 3 months in a row we had 3 different people come in because they tried to commit suicide by setting themselves on fire with gasoline. I cannot imagine what brings someone to that point to think that's a good way to go out. Just last week I had a guy over 400 pounds, BMI 60. He was a hoarder and kept getting cellulitis in his legs because his house was so cluttered. He kept hitting his legs into things and getting cuts and infections. When he came in we had to remove his socks with scissors because he hadn't taken them off in over 3 months. His socks had embedded into his skin and somehow become one. I didn't learn in medical school how that happens. Had a lady come to the morgue in pieces for several days. She had fallen off a catwalk thing into an industrial fan that had no guards due to cleaning being performed on that area in a factory. They were having trouble finding all of her. It wasn't explained to me until 3 days after the first piece showed up, so I thought there was a serial killer out there for a bit. My friend is a doctor and worked in Africa for some time. You can imagine, the hospital itself was a house. You could also have a school in. If no doctor had time, even the janitor would stitch you up. One day, 2 people came in, one with an axe in the head. Surprisingly he was still alive. When trying to get the operation prepared, my friend asked the other guy without an axe in the head who he was. Brother? Cousin? Dad? Friend? No, neither of them. He was the owner of the axe and just wanted his effing axe back. Back when I was a medical student on a urology rotation we had a guy come in after butterflying his penis with a fillet knife. This occurred after consuming a lot of cocaine. It was his 3rd time doing it, all 3 in a fit of cocaine-induced psychosis. You'd think you'd steer clear of the old Bolivian marching powder after the first 2 times. Nurse here. Had a patient come in due to pain in her chest 4 months after having a mastectomy. When we changed her dressings the site was so infected that I could see her lung inflating when she took a breath. She died a week later. Still don't know why she didn't come in earlier. Not my story, but a co-residence. A farmer from a rural area was using a table saw on a hillside. In the midst of cutting wood to build a shed, he slipped on the hillside and lopped off his penis. How plausible this is, whether he was lying we will never know. Rather than seek medical attention, he takes a castration ring used to stop bleeding from castrated goats he kept on the property and shoved it down around the stump. If that isn't bad enough, he also began to have horrific swelling and decided to use a rabbit water bottle feeder, the kind you see in pet stores, to prop open his. He stayed like that for 3 days until he started to have fevers, redness, swelling, etc. due to infection. When he got to the ER, the triage nurse called the urology team. We have pictures. Basically what ended up happening was his urethra was translocated to his perineum so he could still urinate, and his infected, necrotic penis was excised alone with a portion of his scrotum due to the severe cellulitis in the area. He ended up making a full recovery after skin grafting to the area. 70-year-old guy came into the VA clinic for a bad cough and admitted due to temp of 104F. He was mine and I found lumps on his neck on exam. He had tuberculosis, scrofula. So, why does he have TB in the US? We do HIV test and he's positive, been with some prostitutes. He also developed some other complications and was finally discharged after 4 weeks. Poor guy got a cough from sex. Guy called 112 and described his problem as a squirrel in the abdomen. After 5 minutes called back and said don't worry, I took care of the problem. Paramedics went anyway. He cut out his bowels and spleen with scissors. After arrival to the hospital was given morphine and lived for 3 hours. Please, don't do drugs irresponsibly. Edit. Not safe for work. Not safe for life. Edit 2. Drug found. It was called Mokars, N. Hard rock. Mainly synthetic cannabinoids with a little bit of everything. My cousin is a paramedic in a large city and had these stories. Victim is a powerlifter with a home gym. Tries to squat too much weight, and on the upward push herniates his sphincter. When he got there the man had 6-8 inches of his small intestine coming out of his ass. Apparently the medical street slang for this is red socking yourself. Victim is a man with a flashing fetish. Late in the night, he walks to a 7-11, waits until the female cashier turns her back, and then opens his jacket so his erect member is lying on the glass countertop by the register. In a panic, the cashier grabs the first thing she could find, a can of tomato soup, and in an adrenaline rage brings the can down on his erect penis. He said this apparently almost entirely severs the man's penis, which fully erect is moving a lot of blood through it. He said the man nearly bled to death and the 7-11 looked like a murder scene when they arrived. Victim is a morbidly obese man, completely naked, masturbating with a can of soup lubed with honey he's shoving up his ass. In the process, he stimulates his prostate nerve too much, has a heart attack, and dies. That's what he responded to, a naked, sweaty, morbidly obese corpse with a honey lubed can of soup halfway up his butt. He mentions they had to make efforts to keep the victim's small dog out of the room, as the dog was quite drawn to the honey. Please don't think about doing M's unless you're willing to see some truly horrifying-ish. Not a doctor but former psychiatric nurse. I have seen all manner of weird and wonderful things, yet the most perplexing was a young girl we nursed in PICU with history of pica. When we took her for x-rays, due to her complaining her stomach was hurting, we found a belt buckle, a full-size spoon and butter knife as well as an assortment of batteries. As far as I recall, as it was some time ago now, they had to operate immediately to remove, and again if I recall correctly it was the batteries they were most concerned about, as if one exploded started leaking it would have caused irreparable damage. I have never seen a set of x-rays like it, and seeing was believing. Incredible how the hell she managed to get them in there, but never underestimate the willpower of psychosis. Not a doctor but a paramedic told me this one. Got a call to a house where a teenage boy had suffered a penis injury. Remember those glass stirring rods from science class? Kid took one home and put it down the eye of his penis. It broke. Ophthalmology here. I was called to the ED to examine a teenager for a gunshot to the eye. He heard a knock at the door, looked through the peephole and was shot directly in the eye. Unbelievably the bullet stayed within the orbit without penetrating the brain. So when I saw him his globe was ruptured, but he was playing a video game that I had to take away to examine him. Not me but my best friend is a nurse. Said the worst thing she ever saw was a guy coming after a motorcycle wreck. He was still moving, breathing etc in the ambulance, but once he got to the ER, they had to cut his helmet off. Apparently the helmet was the only thing keeping dude alive. Once his helmet came off, his brain splattered everywhere and he was dead on the table. Thanks for watching. I hope you enjoyed your daily dose of vitamin R. Don't forget to like and subscribe if you want to see more. Stay healthy. See you on the next video.